Good afternoon, everyone. Welcome to our first Infant-Toddler Specialist Network call of the new year 2019. We hope everyone had happy, safe, and healthy holidays, and we're excited to be back at work and especially excited today for our monthly webinar and our special guest. This is Monique Wilkinson. With me, I have Erin Smeltzer and Lisette Levy. On the other lines, we also have Katie Dufford-Melendez and Chelsea Markarian from Office of Early Learning. We just have a couple of brief updates for you before we get to our guest speaker, but we also want to make sure that everyone can see and hear the presentation before we move on. So if you can hear us and can see the presentation, please type yes or no into the question box to let us know. Okay, great. We're getting lots of yeses. Thank you very much. So our agenda for today is just a couple of brief updates before we move on to our guest speaker, Holly Wilcher. By the end of this week, we wanted to let you know that you will have a save the date and a draft general agenda for our upcoming retreat at the end of February, which again is going to be the first 2 days of the week of the AELC training camp. So be on the lookout for that no later than Friday so that you can all start your travel authorization plans, and we can too. And because we're having the retreat in February, there will be no Infant-Toddler Network call in February. We have lots and lots to cover at the retreat, so we are going to go ahead and dispense with the call next month. All right. I'm going to ask Holly Wilcher if she could, if she has the capacity to click through slides, but just trying to click onto the next slide because it is yours. So let us know if we'll know if you're successful if the slide changes. Okay, can you unmute Holly so we can talk to her? Sure. Thank you. Okay, Holly, we just resent you your audio pin, so if you could please enter that so that we can hear you, that would be very helpful.
So while Holly is joining in, I'm sorry, we must have lost her. We did check our audio, but sometimes we have technical difficulties. I can go ahead and send you kind of sing her praises, and Holly, just interrupt me whenever your audio comes back on. But Holly has been a really great resource to us here. For those of you who don't know, the office is given a time allotment basically with our technical assistant specialists at the federal level. And so Holly is our infant-toddler go-to for anything that we need at the federal level. I have yet to meet anyone who has the depth of knowledge of resources and what's going on in best practices in infant-toddler development and best practices. So Holly really is just a wealth of information, and she helps us make sure that as we're making decisions here at the state level, that we're considering what's happening nationally, both in research and in federal trends. So we thought it would be amazing to have her come and spend some time with you on this call today and let you know what she is able to do for our state. And then also let you know, hopefully, be able to continue a partnership with you as much as she does with us. So basically, we just wanted to introduce you and make sure that you have her information and her access so that you can get the same benefits that we do here. So let me do a check and see if she has gotten her pin back in. Give us just a second. All right, we're still kind of holding tight. I'm not sure what's happening with our audio. Again, we just wanted to take a second. And while we are, let me try another. While we are waiting on Holly again, if you guys want to use the questions box, we were going to do this a little bit later, but just we can go ahead and bump it up. As we plan our retreat together and our time with you, we really would love to know some things that are burning questions or topics that you'd like to discuss. I know you've done a little bit of that and given Monique some ideas before, but just wanted to just do a temperature on how things are going. We know we have a lot flying at you right now at the state level. So if you can use the questions box, or you can feel free to unmute, we would just love to hear from you on what might be helpful for you so that we make sure that the time is worth your while we're together. So we'll pause for a second while we work on audio and let you use that questions box just to give us some hot topics or some burning questions you may want us to address in February.
For those of you who are asking about the dates of the retreat and the AELC training camp, it is the week of February 25th. So our OEL dates are February 25th and 26th, and the AELC training camp starts on the 27th.
What about now? Can you hear me now?
We can hear you, Holly.
Oh, thank God.
I think we're in business now, so we're going to go ahead and...
Thank you for your patience, everyone.
And so far, we didn't get any ideas in on the chat box. So as you think, you may need some time to process that, but as you think through what you may want to hear at the retreat, or maybe what was helpful during the retreat, please feel free to use that questions box as we go. We'll have it open the whole webinar. So with that, we will pass it to you, Holly. I already told them all about you, and you can just go straight into it.
Oh, thanks so much. And thanks so much, everybody, for your patience with technology and connection. We actually called in and talked for a few minutes and visited about the new year and being sick. And then as timing would have it, we were not supposed to begin at that moment. So I really appreciate being on the call today. And I've really enjoyed and admired the work that Florida has done to improve the quality and access of infant-toddler care. And I brag about the superstars that you all are across the country with what you're doing to make a huge difference in the workforce that supports babies and toddlers, and helping support families, and helping improve access and the quality of care. So really honored to be here amongst my heroes, my zero heroes, which when I worked at 0 to 3, I had a friend, Cindy Oster, and she called all babies zeros. And so I started calling you all zero heroes. So you're my favorite zero heroes, and I'm glad to be here with you today. And I'm just going to spend a couple of minutes talking about the parallel process that we have at the federal level, which is kind of to support what you all are doing at the state level. And that is the Infant-Toddler Specialist Network, which is a familiar name, which is what you are as well, at the federal level, which operates under the auspice of CCDF now law, which is great. We don't have to worry about reauthorization anymore. And basically, with the CCDF law that came about, we required, well, not we required, but the law required that if states were going to receive money through the Child Care Development Fund, that they also needed, or if it's voluntary, if they wanted technical assistance and coaching supports to help them meet the goals that states and territories and tribes put apart in their, or set aside or delineate in their plans. And so this support is completely free and available to all states and territories and tribes, but we do not require, we do not push RTA on anybody. And in fact, it's the opposite. We only can come to you if you ask. And so I'm going to spend a couple of minutes just talking a little bit about the kind of parallel support that we provide at the federal level that you provide the infant toddler caregivers and professionals at the state level. So the next slide talks about just the overview of our, and I can't really advance it. I apologize. I don't see any screen controls here for me to plug an arrow ahead. But are we on the next screen? Are we on the next slide now? I'm not sure.
Yes, we are.
Oh, we are? Okay. I'm going to just pull up my PowerPoint here because somehow my screen is not advancing. So, okay. So again, the overview here is just to spend some time today talking about our center and what we do, and more so how we're available to serve you. And we are kind of couched within a larger network that says it's really important to support early childhood comprehensive systems work within, because we know that the field of early childhood and the system of early childhood federally, you could not build a more fragmented, disjointed non-system of systems. We have 19 federal funding streams that serve essentially the same children. And in states, you're asked to do this magic work of coordinating it, making it seamless, and serving all families and children elegantly and supporting the workforce. And yet it's disarray at the national level because we have no coordinated model. And so I serve, in the next slide, you'll see the Region IV, which you live in, and the country or the federal government districts off, they segment off the districts or the country into segments, kind of like the Hunger Games, if you read that series. But we are in regions, rather. Region IV is the largest region. You're a member of the largest region in the country of 10 regions, and it includes your friends and neighbors from North Carolina, South Carolina, Georgia, the headquarters for the federal offices in Atlanta, yourselves, Florida, of course, Alabama, Kentucky, Mississippi, and Tennessee. So those are the states in Region 4. And so I, as an infant toddler specialist, there's 10 of us on our team, and we're each assigned to a region. And my region is Region 4, but we work across regions, and we work with each other as well. And I also serve Colorado because I'm living in Colorado right now. So a bunch of these states have lots of different infant toddler initiatives like you do. Some of them have infant toddler specialist networks. Some of them don't. Some of them have a strong infant toddler in their quality rating and improvement system. Some of them don't. Some of them have credentials and competencies, and some of them don't. So we, can get into that a little bit later, the nuances of how we support each of the states, and I'll give you some examples. So in the next slide, I'm going to show you just a quick reminder of what you're already very familiar with, and this is kind of the state of the state. This is why we exist. So in the CCDF, when the CCDF law was reauthorized, I don't know if this is interesting to you or not, it was to me, they said that they saw that the need was very dire. And in 2011, when there was reauthorization of Child Care Development Fund Act, before it became a law, they said, you know what, we're going to not just make sure that we're giving money to states to subsidize childcare for families who are working. We want to make sure that that's quality. And we also want to make sure that the poorest quality is addressed and the most vulnerable populations are addressed, which the early childhood advocates who were pressing for the Act reauthorization identified infants and toddlers. So we know just that there's a huge rationale for making sure that in the Child Care Development Fund dollars that states receive, that a significant, I shouldn't say significant, that's arbitrary, that a certain amount, a percentage of dollars, as you may know, has to be spent on focusing on how the state is going to make sure that these statistics are different, that infants and toddlers are focused on, that their quality of care is a priority, so that, states wouldn't just throw, or territories wouldn't just throw money all into subsidizing child care for 4-year-olds or 5-year-olds, or just putting it all into a quality rating and improvement system, or all into, a different complementary initiative. So because the state of infant toddler child care quality is so poor, and infants and babies and toddlers are so very vulnerable at this age and have so many different needs, as you know, this is why in this reauthorization of the law, there is a specified focus on infant and toddler, set aside, as you might have heard, for infants and toddlers. And so lots of, nearly 7 million children under the age of 3, we know, spend time being cared for by someone outside of their maternal or paternal, their biological, their parents or their grandparents or their primary caregiver. And unfortunately, most of that care is not quality, as measured by our kind of widely accepted measures of quality that you may use in your system, and other states use different tools to assess that as well. And the next slide tells you a little bit about the conditions of the workforce that you support. And you are probably very familiar with this. I work with infant-toddler specialists all over the country, and a lot of times I get into asking them, what's the biggest thing that you're focusing on with the teachers? And they'll say, you know what, she couldn't keep her lights turned on, and cannot afford to stay in her apartment for another night. And so she cried for an hour, and I comforted her and listened. And that was the infant-toddler specialist visit. And that is a reality of kind of what a lot of infant-toddler specialists and consultants and coaches are dealing with, because of the deplorable workforce conditions that our infant-toddler caregivers are in right now, because of this lack of a federal infrastructure and this lack of evaluating, culture to support a seamless, voluntary, universal birth through 5 system in our country. We are dealing with piecemeal, fragmented early childhood funding, such as Head Start, Early Head Start, and child care. And I say that because it's not because I want to be disparaging of the system that I work in, but just that this is the reality that you're dealing with every day. And to sugarcoat it and pretend like, they make a livable wage and that the workforce conditions are excellent would be dishonest, right? And not honoring what you see on a daily basis. So this slide really tells you, hey, this is kind of what they're earning on par with their peers. And the interesting thing is that toddlers and infants, are a huge part of the percentage of children that are served by the Child Care Development Block Grant or the Child Care Development Fund. And of those, a family home is the second most common setting for infants and toddlers. More toddlers are cared for in centers by infants. So that data may be different from state to state. So I hope that this picture that I painted wasn't super depressing, but more of, yep, that's familiar, or, this is why I'm in the field, and I want to make a difference and serve these amazing heroes, zero heroes, who are trying to make this a different picture and increase the quality and increase the access and support a workforce who will stay because they have good workforce conditions and they're paid a livable wage and they have the workforce supports from their leadership and the like. And it's rewarding and valuable, and they can serve babies and toddlers. So That is kind of the picture of the country right now for infant toddler care. And the next slide gives you, kind of takes us back up a little bit, and that goes to talking about where we are, kind of a more kind of rationale for why we exist. So again, the Infant-Toddler Specialist Network exists within a larger state capacity building center whose mission is to help states create connections of the defragmentation of the system. So, and with where we sit, our Infant-Toddler Federal Specialist Network that works in parallel to supporting you all, is to help states and strategies do anything related to this red text here that you see. Develop strategies around whatever it looks like for you, whatever your strengths and focus may be, to improve the supply and access of quality infant toddler services. So again, that requirement is a minimum of 3% of those federal dollars that a state receives has to go to the babies and the toddlers and the folks who care for them. And so you can see our other objectives within that is to just, make sure that you're not alone in the struggles and the goals that you have, and to help you dream big for babies using this the capacity that we have through the Child Care Development Fund. So the next slide is just a little bit more reiterating of what I described before, and it gives some more verbiage about the Infant Toddler Specialist Network and kind of how we work. And we are kind of sister brother partners with what's called a state system specialist, who is that there's a state system specialist for each of the regions in the country as well, as an infant toddler specialist. And that person kind of works as the broker or the triage. So anytime your Child Care Development Fund state administrators have a need, they can come to the state system specialist, Calvin Moore is yours in Florida. You've probably met him and familiar with him. And they say, hey, Florida would like some support with XYZ. And then that state system specialist really thinks big picture for Florida and helps Florida or your neighbors, Georgia and South Carolina, or whoever, connect to the next support that might be helpful in helping you meet your goals related to the Child Care and Development Fund. So that is, and then what Florida's also a part of, and I'm not sure when it sunsets, but Erin's probably let you know, is a more kind of intensive support opportunity. And I think you've done a lot of equity work, and you've done a lot of work in your quality framework that's really been lauded across the country as exemplary. And that is more of an intensive capacity building network. And your technical assistant support person there is Desiree Reddick-Head. And so probably familiar with her, have heard her name or met her. And that's the third kind of cog in the wheel of our network approach, of our state kind of center approach. And then the next slide, after this cog wheel slide, is really about, talks about, this may be kind of similar to what you feel you might provide to programs and providers who you work with. And this is what Erin was describing earlier when she introduced me, and I appreciate her kind words, as the levels of services. And maybe you can think about yourself and the types of things you do with the caregivers and teachers that you support along this kind of pyramid of continuum. The pyramid is so popular as a description for how we do our work, right? From the social emotional pyramid that a lot of us work with to how we deliver technical support. And this is kind of the continuum or the continuity of care, if you will, of how we can support states. And knowing that, no state may need the same thing. Some states I work with, for example, North Carolina, the other day they called me and they said, Holly, we want examples of all of the states' introduction or orientation for infant toddler caregivers. We want to develop an online orientation for new infant toddler caregivers to help them feel welcome and kind of ready to hit the ground running. And then I don't hear from North Carolina, a lot. So I may hear from them, whereas with Colorado, I'm helping them revision and remission their whole infant toddler child care initiative. So, that's kind of, it's just this level of services that we support, there's no wrong place. And that's kind of probably maybe how you feel in the programs and in homes that you serve, that sometimes you're there for a brief while, maybe you're there for a long term. Regardless of what you're doing, it's relationship-based and outcome-based, and you're working on meeting the needs of your providers. And so that's why we exist, is to meet Erin's needs and Erin's, your team's needs. No ask is too little or small. And even if you don't feel like maybe it falls along this continuum of this period from tailored to intensive to targeted to universal, I bet if it has to do with babies, we can help you and support you in that way. So the next slide talks about a little bit about the kinds of things that we do. This is super broad, and you may have a TA menu that you provide your caregivers and providers as well. And maybe they don't need a menu. You kind of have a goal, an agenda, an outcomes generated plan when you work with who you work. But some of the things that the big broad goal, as I mentioned earlier, is making sure that those child care development funds that are specifically allocated for babies and toddlers to support the quality of care that their families receive and the workforce that supports them are effectively implemented. And that can look like a lot of different things. We also work with states to make sure that subsidy and licensing policies are really speak to babies and toddlers and what their needs are, and that there's eligibility is longer, and not just now it's a 12-month requirement federally, but we knew that before that there wasn't a 12-month requirement. Sometimes there's 24 months that states are coming up with for subsidy. And so we also help states work on just improving the coordination of those people who touch the lives of babies and toddlers across sectors and settings. So in South Carolina, for instance, I'm working with them right now to really advance their infant early childhood mental health system, to make sure that all of the people who touch the lives of babies and toddlers in a way to advance their early childhood mental health kind of have a common picture and a goal and see themselves in the same setting to advance that. And I know that your association is very strong, and you've moved forward with purchasing that endorsement in Florida and are doing some really great things around early childhood mental health in Florida. Some of the other areas that you'll see here might look familiar to you, things that you help providers do all the time: advance along their career in meaningful ways, with career goals that are important to them. And then a lot of states, with the federal requirement for an effective consumer education and outreach and awareness campaign, we help states kind of put that together. And what does that look like is different for babies and toddlers and consuming the care for infants and toddlers versus maybe a preschooler. And then finally, a lot of ways that we work with states are through the Infant-Toddler Specialist Network, through coaches and master teachers. And this looks different across every state. Not every state has a network exactly like yours that's as sophisticated. Some have 50 different coaching initiatives, and infant toddlers is a small part of maybe the quality rating and improvement system or quality framework, or it's a literacy based, and then babies are kind of a little bit of an afterthought in terms of the caregivers who receive support. So states are trying to develop infant toddler specialist networks and develop more communities of practice amongst themselves to help support them. I'm doing a lot of work right now helping states with virtual coaching and how to maintain relationship-based coaching practices and relationship-based professional learning environments at a distance, and what mediums can you use and be effective and still have that strong high tech and high touch element of why we know that you're doing the work that you're doing. So because you care, and you care about the caregivers, and you care about those babies and toddlers. So on the next slide, just to go back up 30,000 feet again, we're going to give you a look at kind of how we are positioned across the country. So if you do happen to leave your sunshine, beautiful state of Florida and you go somewhere else, there's an infant toddler specialist and a child care specialist, like I mentioned, in every single region. And yes, you should be proud. Region 4 is such a beautiful region, really dreaming so big for babies. And I like I said again, I'm always asking for examples from Erin and of, what are you most excited about what y'all are doing lately? And I'm bragging on the great work that you all have done in your network and what you continue to do to make a difference in the lives of the workforce and the babies and toddlers. So the next slide is a little bit, goes back a little bit more 10,000 feet into a technical view. When the reauthorization of Child Care Development Fund that kind of guides the work that we do came back out, we said, you know what, we need to have kind of a systematic approach, much like what you do with your programs. You may have a problem that a caregiver brings to you, but you look at that problem or that potential that grow in the context of the whole program or the whole home, and how you can support and sustain that caregiver. And so we do the same thing with the requests that we get for support. And this kind of flow chart here just is an illustration of that. We look at how the request that we get from a state or territory, much like you would look from the request or provider, fits into the larger context and the need. What is the quality, what's the overall kind of climate and culture of that state right now? Are they they have lots of strong childcare policies. They have, not a great childcare climate. What's going on? How can we help? Regardless, we kind of look at their readiness for change, and more about that probably than me, and looking at readiness for change than the caregivers that you work with in the program. So it's a huge thing. We can have all the best practices in the world and all the greatest knowledge and skills, but if there's not a readiness for change, if there's not a driver that's available for that provider, or the capacity for leadership support, sometimes things aren't going to be sustained, right? Regardless if we've got the best pyramid model practices, we need that readiness for change and that sustainability parts there. So these are all the things that we kind of look for, much like what you look for when you're providing coaching in your programs. So one of our kind of guiding principles, as you kind of have a guiding principle framework, you may use a theoretical approach that you find most comfortable or sits most well with you in your work. Maybe it's the project approach, maybe it's Montessori really speaks to your heart, maybe pyramid really is the song that you sing, maybe DECA or evidence-based practice-based coaching or something. And we have something that we kind of fall back to as well, not fall back to, but it's when we, when people ask, well, how do you operationalize quality infant toddler care? We fundamentally say that there are 6 essential basic practices and policies, and this can look very different. This next slide, you're probably familiar with the Program for Infant-Toddler Care, but these are kind of what we use to frame a lot of the work that we do. We have a training of trainers that we've taken out to states that we can give to you, that we can provide and co-facilitate with you on the 6 essential program practices that you keep and take and you can train on forever if you'd like. And these are just, this is probably stuff in your sleep. It's just the stuff that we know happens when babies and toddlers are in really great environments. And that individualized care, small groups, primary care, continuity of care, inclusion of all children, regardless of ability or need. And then that cultural, I like to say competence and proficiency. That's our goal at the end of the continuum, right? Not just responsiveness, but at a very baseline, basic, that responsiveness. So the Program for Infant-Toddler Care is kind of one of our guiding principles, if you will, of our Infant-Toddler Specialist Network. But it's not the end-all be-all. We know that states have different cultures and tribes have different cultures of what they value, and we absolutely honor what the state brings in terms of your framework and your guiding principles for how you operationalize quality in infant toddler care, whether that comes through your licensing or your quality frameworks or your subsidy or your professional development system, there's no wrong place to get it. So this is just ours, and it's pretty evidence-based, and every kind of curriculum and approach really falls within it. On the next slide, you'll see what we think is a growing and building resource for you. It's called our Infant-Toddler Resource Guide, and if you're looking for kind of videos to show your training or coaching, we have great infant-toddler care video clips with some activities and extension of learning, kind of application of the PITC principles that you're very familiar with and what it looks like in practice. And then we have sections of this Infant-Toddler Resource Guide based on your role. So it's a little bit small, but you're a PD and technical assistance professional. That's not the only thing that you are. You probably wore a lot of hats that have gotten you to the amazing supportive role that you serve now. So we've got a section for the folks that you serve as well, those providers. And we've got a section of resources that support people who are trying to decide how to use the infant-toddler set-aside dollars that come from the Child Care Development Fund, and how to make strong infant-toddler child care policies. We have a tool that a small stakeholder group in Florida actually piloted on strengthening infant-toddler child care policy. And there's 5 sections of that. If a state's ever wondered how are my policies supporting and childcare supporting strong infant-toddler quality infant-toddler care, there's a bunch of practice and policy indicators in there that you can look at to say check yes or no if you're implementing those or not. So, and a lot of other tools, a lot of other resources. So I encourage you to, I'm sure Erin and others and Lisette and others have shared this, or you've seen it maybe in a presentation somewhere else. But you can bookmark this, and we do updates regularly. And if you need something that's not there, if you want to say, Holly, I really need videos on ABC, or I need a resource that shows what responsive caregiving, a checklist. That's something I worked on with Georgia last year. Just come to us, and we're here to help you with your heavy lifting, where maybe our hands are so full with the amazing work that you're doing that you need someone else to kind of as a thought partner, as a shoulder along, as to cry with, or to laugh with, or to vent with. That's part of what we do too. So the next slide is just a little bit more of an example of kind of some things that we've done with states. We've helped with infant-toddler relationship-based professional development efforts. If you're revising your coaching model, or we've co-delivered the training of trainers for a program for infant-toddler care, and that we don't own that. We developed it under the Child Care Development Fund support, and it's yours to take. And just really help you achieve any goals that you have related to quality infant-toddler care. We've helped states develop infant-toddler competencies and credentials, endorsement certificates, you name it. Anything that kind of falls under the sun there with babies and touches the lives. This next slide is super kind of technical, and we had to put it in here, but it's kind of it's different. When we get a request from a state, it's a little bit of red taper stuff. Like if I got an email from someone in Las Vegas who found a presentation I'd done online on reflective supervision, and I can't exactly email her right back. I have to contact the federal person and then say, hey, I got an email from this person, and they need to. So sometimes when you get an email, you can just reply, and I can't always do that, but I can eventually get there. So this slide just talks about that TA communication protocol, because we have to cross our T's and dot our I's to be good stewards of the dollars and the technical assistance that we provide. And then I know I've been talking a lot, and so I'm going to pause and see if there's any questions, comments, reflections, concerns.
Holly, thank you so much for all of this great information. I'm going to encourage all of our specialists that are on the call right now to please use the question box on your webinar window to type in any questions or comments that you have for Holly based on the information that she's just given us. So we're going to give everybody a couple of minutes to think about that and type them in. And I know a couple of our specialists from around the state did send me some excellent questions that they wanted to share. So I encourage them right now, hint, hint, to please go ahead and type them in now so we can address them. We'll be back in just a couple minutes. Holly, I know that while people are still typing in, I remember that one of the questions that was sent to me from one of our folks around the state is what vision does the State Capacity Building Center hold as in terms of what they would like to see happening for infant and toddler care, not only in our state but across the country?
That's such a good question. I mean, right now, we have just one of the most dire situations we've seen in terms of losing infant toddler care providers, specifically family child care. They're dropping out of the field in mass proportions, and we have deserts that we've never seen before. So, 10 years ago, we might not have said that increasing the supply was a huge priority, but that has really been a prioritization of this current administration. Shannon, the director of the Office of Child Care, has a huge heart and is a really great listener. If you ever get the chance to meet her, she comes to Florida, tell her everything that is your biggest, kind of hope and dream and what you're seeing. And she, do her best to listen and try to speak to it at the federal level. So I think one of our biggest unfortunately, it's kind of a fires and treading water is to get the supply, to get providers, specifically for babies and toddlers, because we're at a crisis level of a shortage nationally. The other thing that is a big priority is family child care. Knowing that that's the preferred location for a lot of families who have children under 3, we're really trying to increase the percentage of family child care providers we have. There's lots of innovative strategies. I know Florida's been really interested in, what do the staffed family child care networks look like, and supporting early childhood hubs and shared services to support the recruitment and then sustainability of family child care providers and programs for that matter. At this point, really don't care where they are, as long as they can afford to provide quality care for babies. We need and want. And so we're helping states and territories really focus on that. And that's kind of a little bit of a crisis-y response. Several years ago, we were working more on, the focus was more on kind of meaningful professional pathways and credentials and endorsements, and really getting folks the competencies and workforce knowledge and skills that they needed. And that's absolutely in parallel as you're doing every day. I'm your specialist, kind of working on that. A lot of momentum is in quality rating and improvement system dollars and those machines that drive a lot of the work. So we're working a lot on how a lot of focus is on leveraging quality rating and improvement systems for workforce recruitment and retention of those baby and toddler providers, and then the career advancement of those providers. So I would say, not necessarily in that order, but that's a lot of what we're working on now. And then a lot of folks are just kind of looking at, the configuration that you have, the team that you have on today. How do we support the people who are supporting the caregivers, in that parallel process? The work that these women are doing on a daily basis is superhero is on the par of magic and reflective caregiving, and you're providing that continuity of care to them, to these caregivers that they're providing to babies, and holding this deep and heavy needs that they have. And how can we support networks to function in a way that allows them to be there for the caregivers? And so a lot of networks are revisioning and repurposing. Some are just trying to band together and develop a network of support, like you have created in Florida. So those are some big ones right now, I would say.
Thanks, Holly. And to piggyback on the last few sentences that you were mentioning, one of the questions from our folks in the field is, what do you recommend to teach infant toddler teachers their worth and that they're not just babysitting, and what do you recommend to help them understand their value and how important they are?
Oh my gosh, what a great question. I think that the relationship that you create with them is such a great a parallel model of modeling exactly that. The importance of you being there and holding the heavy burdens that they have is in and of itself kind of through the transpiring of that relationship, that self-efficacy develops, as you've probably seen, that confidence. I think that one of the best models that we have of coaching is this strengths-based, the GLOWs kind of. And I remember working with an infant toddler caregiver one time on a strengths-based model that I was piloting, and she said, "This is the first time I've ever had TA or coaching where someone didn't come in and tell me what to do and tell me what I was doing wrong and tell me what to do, but solely focused on what I was doing well and what my strengths and my specified skill set, even if it was, and she said that made me want to try new things. It made me confident." So I think in any way that you can focus your TA, your relationship-based professional development supports, that might look like consultation one day, answering questions another, holding her hand the next day when she cries, or finding a welfare support for her, a mental health support for her. In any way that you can focus on the GLOWs and the strengths that the provider is bringing and the value that she or he has, in what they're doing in every day, that data and the research that we have on strengths-based coaching, it keeps teachers, keeps caregivers in the field. It B, helps them increase their self-efficacy, which is a huge correlate of quality care. Well, what researchers are telling us now is that we've created these huge, sophisticated quality rating and improvement systems, but what Rick Feen and others are finding, June Lee from the Fred Rogers Center, is that the simple and the deep, the relationships, the simple quality interactions, those positive strengths-based interactions that caregivers can have with infants and that we as support personnel can have with caregivers are the magic. It's what makes the difference. And I don't have slides on that today, but I have a presentation on that, on strengths-based coaching and TA, and kind of the change that makes in practice and programs and quality and sustainability and continuity of care and teachers staying in the field. So I'm happy to share that with you. I know I was maybe a little bit all over the place in that answer, and that's pretty much a micro level, kind of you're on the boots on the ground, feet on the ground with what you're doing. So I hope that was helpful. I have other policy.
I'm sorry, Holly, go ahead.
I have other kind of policy systems level responses as well, but that's for another call.
Absolutely. Thanks for that. We have another question. In your experience, which state have you seen that is doing the best job of meeting infants and toddlers' needs, and why is that? What are they doing that makes them stand out?
Wow. this is such a good question, and I get this. I think that in parallel to probably what you see in your programs, each of your programs has a glow, a strength. Maybe it's parent-family engagement. Maybe it's caring for children who have different abilities and needs. And I think that there is no state who really has it all together. And the ones that we kind of, for instance, we just reached out to Florida to kind of, you're piloting, this equity frame and really thinking about your work in this regard. And you've piloted an endorsement that you're not piloting, you're beyond that stage now. But, a lot of states will ask me this question and then, the states that, I think that the bottom line is we have to look at kind of how are the babies doing and how are the toddlers doing and how are we measuring that? And everybody's using it a little bit different. But I think that the states that are doing the best job really comprehensively serving the babies are the ones who are doing the parallel work at the state level of what they want to create for quality infant and toddler care. And what that means is you have strong relationships with your early interventionists. You have strong continuity of care and connections and communication and collaboration between your mental health specialist, with your health across all of the baby and toddler serving sectors and settings. And there are, some states who have done a really good job of really coordinating and collaborating. North Dakota, when they go out and they get a request from a state for a potential suspension or expulsion of a toddler, they go out as a team. The infant mental health specialist, the infant toddler coach, and the licensing and the health nurse go out together, and they assess and they kind of, not to bombard the program, but just to visit and build a relationship and to see what is the need. So that's but North Dakota, how are they with infant and toddler, data and outcomes and poverty, and not so great, but I think it just depends. We had kind of what we're putting together now that may be helpful is kind of a list of exemplary practices that we've seen from the Child Care Development Plan funds that were written for the 2019-2021 2 fiscal years. These are the plans of how states said they were going to spend their dollars, and specifically on infants and toddlers. So there are some strong innovations from that we're going to try to pull out and extract. I think the ones who are also focusing on a strong infant toddler network and really pouring into the community that you all are to support one another so that you can in turn support the caregivers that you serve, that parallel process. Any state who's creating that parallel process is really seeing some great outcomes for, and I think it's kind of depends on how you define a success too. I think for workforce turnover is reduced there with the more infant toddler supports that they have, the more access to coaching, and then I think the states who are really investing in the relationship-based professional development supports for the workforce, knowing, we're not going to get at a $60,000 salary for an infant toddler caregiver in the next 5-10 years. But what can we do? The things that you're doing that can keep a caregiver in the program with the baby, or doors open, or the family childcare home open. So in the states who are doing really strong workforce supports, things like Georgia, your neighbor, is really kind of pouring into that and your coaching and supports there. So I know I was all over the place with that answer, but I appreciate you listening, and I'm going to make a note to get those innovations and share them with Erin, so you can kind of have more of a kind of categorical kind of here's who's doing well in A, B, C, and D.
Thanks so much, Holly. And a couple of our listeners have expressed a strong interest in your strengths-based coaching presentation. So I would love to talk to you later or tomorrow and see if we can get you scheduled for another one of our calls in the near future.
Okay.
That's the end of our questions. So again, we really appreciate you joining us. Thank you so much for your time, and for all the rest of you that are listening, we are about at the end of our time. So again, no call next month, but we will be seeing you at the end of February at the retreat. And again, as Erin requested earlier, please do send in your comments or your suggestions or thoughts about what kinds of burning questions or thoughts you have that you would like to see addressed or discussed at the retreat. And that's all for today. Thank you so much for your attention and your participation, and we look forward to seeing all of you very soon. Thank you. Thanks again, Holly.
Thank you all, and thanks for your patience with the later start.
It worked out perfectly. Thank you.
Great. My great pleasure. Bye.
Bye-bye.